today we are back with a new video. In this video we'll be teaching you guys how to score well in your interviews, because interview is the only thing that will get you a job. Even if you have AMC 1, AMC 2, good CV, doesn't matter. If you suck at interview, then you're not gonna get a job. So let's start.
Let's begin.
So first of all, the most common question that's being asked is, they'll ask you, go through your CV, walk me through your CV, something like that, or tell me about you. So to answer this question, you should be very thorough with your CV, what you have written, and you should be having the brief script of like 1 to 2 minutes, so that when they ask, you give the best presentation of yourself. Don't sell low. So if you're giving a good presentation of what you have written in your CV, then that's really impactful. So you start with your journey, like I started MBBS. During MBBS I did this, and if you have done your specialization, then during that period I worked like this, and I did these publications, that was academics and stuff like that, extracurricular maybe. So you can speak everything you have written in your CV, but in very crisp manner.
Another question that we see almost always in interviews are based on ethical scenarios or workplace scenarios that we face quite common. These are in the form of like conflict kind of cases. For example, that a nurse wanted you to do so and so, but you didn't do it. Now the nurse has some complaints. How will you manage the situation? Or it could be something like your registrar or your senior is coming in late every day, and your ward runs are starting late every day. So how will you manage that situation? So these are basically just things that you will come across in your workplace, and they want to see how you will tackle these situations well.
Yeah. And that's very important question, because if you don't answer that well, it's very downgrading.
Yeah, and these kind of questions also assess you on your communication skills, on your language. So they do look at all these things. Yeah.
And next they ask like clinical scenarios. They have various clinical scenarios, starting from a person coming with shortness of breath and maybe altered sensorium, or maybe an elderly came with a fall. How you'll assess. It's not like a MCQ question, it's a long question type scenario. So they'll give you, for example, 78-year-old male came with loss of consciousness, he had a fall and now he's in emergency. How you'll approach. So you have to start with the history, what all questions you are gonna ask, examination, A to E approach, and investigations, what are your differentials. So you have to go like that. Same for the chest pain and maybe shortness of breath, altered sensorium, all the differentials. So these are the clinical scenarios most common, and
Other category of question can be about your management skills or your leadership skills. They could just ask you a simple question that, give us an example where you were a good leader, or give us an example where you managed some situation well. Or it could be a bit more twisted, where they'll assess your skills, like your teamwork skills, or just how you prioritize tasks. So it can be in various forms. All they're trying to see is what kind of a leader you are, or what kind of a doctor you will be.
And one more question they usually ask is, what are your long-term and short-term goals? They can ask just after your basic questions, before the clinical ones, whenever they feel like. So in short term, you have to tell like what are your plans for now, and what your long-term plans, like which specialty or subspecialty you want to work into, and if you are into research, then what kind of research you are interested in. So all the things like you can tell them, just to make it look good and just to take it out like what is in your heart. So basically you don't cram anything, but you should know like what they are expecting to listen. So that's a very important thing in an interview. And I have seen multiple students who will just cram the answers given in Facebook groups and everything, but the scenarios change, the questions change. So if you have crammed the stuff, you are spitting out the crammed part. That's not very good. It doesn't stand out. So probably you'll not get that job. So it's better if you understand the question and the expectations. So yeah.
There's one more kind of questions that can be asked, which can be slightly tricky because I don't think in our home countries we come across this very much. So they could ask you things like what is clinical governance, or what's the audit, and whether you've done any kind of research or publication, and explain. So I think you'll have to read more about these kind of questions just to have a basic idea.
And so that's all, I guess, one of the main questions.
Yeah.
And you prepare well for your interviews, because interview, as I told you earlier, is the most important step of your AMC journey. And if you still have any questions and you want us to guide you guys like one-to-one sessions, just let us know, because we're getting multiple messages on Instagram and YouTube to get the sessions, but we are not very sure what you guys want. So if you want us to conduct some one-to-one sessions, just let us know, and we'll be happy to provide you half an hour, 1 hour session before your interviews and listen to all your answers, give a feedback, because if you perform well in the interview, that's the only point where you are gonna get the job. So work really hard for the interviews. CV doesn't matter, your degrees doesn't matter. If you are good at your interview, you are confident enough, you're gonna get the job, and you will get the job. All the best. Comment below and let us know. Show some love, subscribe, comment, like. Yeah, that's all we can expect right now. Just do it. Bye.